Welcome back from lunch. Please remember to click on the expo to visit our sponsors and get your gamification points, or the Learning Lab for hands-on presentations, or to make an appointment, reach out individually. At this time, I'd like to introduce Dr. Michael Pulley, Associate Professor of Neurology, Director of ALS Certified Center of the University of Florida, Jacksonville.
Good afternoon, everybody. My pleasure to be able to speak to you all today about telemedicine for ALS patients. It is something that has sort of taken off even before COVID. We were involved in one of the first research projects in telemedicine. And just to start off with a definition of telemedicine, it's any form of remotely caring for a patient. You can use remote monitoring, you can use telephone, you can use video, or any combination. So the remote monitoring, people who use CPAP machines like for sleep apnea, and even patients who have ALS who are using BiPAP or Trilogy machines, you can remotely monitor the use of those devices, and that's a form of telemedicine. But most people think of it more in the sense of a video connection with somebody. And in neurology, we've used it quite a bit in stroke, where there's not a stroke doctor locally who can evaluate a patient, but they can do it through a video connection from their home to the hospital to evaluate the patient. Now, for ALS, of course, we know that delivering care through multidisciplinary clinics is the best way to care for patients. It's been shown to improve quality of life based on the ALS functional rating scale scores, and also survival. People survive longer if they're cared for in a multidisciplinary ALS clinic. But unfortunately, some of the clinics are far away from where patients live, and so it can be a big burden for patients to get to the ALS clinics. And even for those who live pretty close by, just getting into the vehicle, getting to the clinic, getting back out of the vehicle, getting into the clinic room, etc., all that stuff is a big challenge for patients. And so this disease is really ideally suited for caring for patients using telemedicine, where they can stay at home and access the care of a multidisciplinary team. But the question is, can you do it that way? Is it the same, or is it good enough from the patient perspective and from the caregiver perspective? And I mean caregivers as in the care providers, the doctors, the therapists who take care of patients. So in order to increase access to this multidisciplinary care, telemedicine can be used. And it has been used, and I'm going to show you some studies that we were involved in and some other facilities have also been involved in that have shown that patients really love it. Caregivers generally like it. Some of them don't quite love it, but most of them still like it and feel that they can care for patients using that method. So our study was one that used a very different model, and I'll go over that a little bit with you guys. It's called the store and forward method. Most places, and even we now, have started using a more live method of multidisciplinary care. But we did a research project through the ALS Association and the Florida Department of Health that funded it. And I'm going to show you some of the results of our study here. So in this study, patients were asked these questions. I'm sorry, let me go back. And were they comfortable having their examination recorded? Were they able to explain their medical problem clearly? So there were 27 visits, and every single visit was rated as either strongly agree with this or agree. So the possibilities were strongly agree, neutral, disagree, and strongly disagree. Those were the possible answers for it. And every single one of the patient visits was rated for telemedicine as either strongly agree or agree, and almost all of them were strongly agree. And they felt their privacy was good, they felt they had enough time, they were able to understand the care plan, etc. And this is in comparison to the visits in the clinic, where there were 18 total visits, and patients were a little bit less I would say happy, whatever, with those visits than they were with telemedicine. They actually seemed to like telemedicine even a little bit better. And so we came to the conclusion was this method of delivering care to patients is doable, feasible. We used inexpensive equipment. We basically just used iPad devices. And the way that we did it was a nurse came out, did a very comprehensive assessment, broke it down into segments that were then viewed by team members. We then interacted with the patient in a live video chat to discuss all the care plans. And we tried to get all that stuff done within 1 week of the time the nurse went out to the patient's house. And the patients really liked it. The providers, and here's a bunch of questions that we asked providers. There was a lot more variability, and interestingly, it was certain providers, and in our case, the nutritionist, for some reason, she didn't seem to like telemedicine nearly as much as a lot of the other folks did. So she used this blue bar that's kind of low in a lot of the questions. But almost everybody still felt that they could develop a care plan for the patient based on the video. That's question number 5 up in the top right corner of these bar graphs. And that's probably the most important issue. Can you develop a care plan for the patients? One of the first studies that had ever been done was the Cleveland VA, and Dr. Selkirk up there in Cleveland had done a telemedicine study over quite a long period of time, but not a lot of visits. But they also kind of felt that patients with ALS are ideal given the disability, the complex nature of their care, and they felt that telemedicine visits are very similar to face-to-face visits. And we had found that patients who had stopped coming to our face-to-face clinic were able to be cared for by telemedicine. So some people who had been totally lost to multidisciplinary care now are able to access it again. So that was quite a good thing that we saw from our study. Similarly, the folks at Penn State, Dr. Simmons is the head of their ALS clinic. And again, this graph that we're looking at here, the right-hand side is good. It means that everybody thought it was a good thing. They would do it again. They were overall satisfied. It was easy to use. It was, etc. There was good communication. There was enough time, etc. And basically, again, everybody is on the right-hand side of the screen. Some people, again, I don't remember specifically what these bars are. I bet the bottom one is actually the healthcare provider. I think it's patient care, caregiver, and healthcare provider. So some of the healthcare providers don't feel that it's quite equal. Naturally, some people want to actually have a physical interaction with patients. And then Mass General had quite a large number of patients. They had 87 ALS patients who they cared for over the course of about a year and a half. And what they found was some of these people lived quite a long way. 211 miles was the median distance away from the clinic. And you would think that more advanced patients would be the ones who participate, but more than half the people were still ambulatory, still able to walk at the time that they did their telemedicine. And again, everybody's coming to the same conclusion. The video televisits are feasible, meaning they're doable, they work. It can be a useful tool to supplement the traditional clinic-based multidisciplinary ALS care. So everybody kind of agreed on that. So how is this going to take another leap and start to be used for research for ALS patients? Although ALS has the largest drug pipeline among the neuromuscular disease with over 160 companies, it's hard to recruit people to go into these studies. And some of that is that, again, just like the clinics, that's where the studies are being done, typically. And so patients have a difficult time accessing them. And we would love to be able to have them access the studies as well and increase recruitment. Well, telemedicine is being used for recruitment of patients in the studies, to do consenting, we call it e-consenting, and even screening people to see if they're eligible to go into trials. There is a growing movement towards collecting all the data, and that can include breathing tests, it can include grip strength, it can include other things that assess people's function. And of course, one of the outcome measures we've always used, and most of the patients have done in the ALS clinics, is called the ALS Functional Rating Scale. But the barriers here are still validating the outcome measures. That some of them haven't been done a lot, and so we want to be able to get them validated by more and more experience with them. Some have these licensure issues where going across state borders is an issue. And so we're trying to get some of those things worked out. Technological, some patients don't have good internet access, so it's hard for them to have a good, consistent internet connection and that kind of thing. But telemedicine is going to be the next wave of ALS care, and the COVID pandemic has taught a lot of people that it's pretty easy to do it, and we're overcoming a lot of these challenges. So in conclusion, ALS is really ideally suited to be cared for by telemedicine. Patients are really satisfied, and providers feel that they can care for patients. And I believe that as time goes on, we're going to be using it more and more to conduct clinical trials for ALS patients and solve some of our recruitment issues. And I'm going to stop there and look to the chat discussion, see if I can get some questions. Okay. So one question was, do you have a nurse present to telemedicine with this program? So the one that we were doing called the restore and forward method, where she recorded it, she would edit her video and then send it to all the other providers in the clinic who would make an assessment of the patient. So that's the way that worked. I think I am out of, let's see, I think we have a few more minutes. If anybody else has questions, we can put them into the chat box if anybody has a question. Right, so somebody says, do I think smartphone technology like FaceTime will also move telemedicine forward? That's one way, because actually we use that quite a bit when we are doing telemedicine in the clinic now. Some patients don't have laptops, but they have a smartphone. And so we are definitely doing that. And we will definitely be using that also for studies. The other way that we're going to be using smartphones is some of the outcome measures. There are apps that you can put on a phone that can do things like somebody tracing a pattern with their finger, or reading a passage that can be recorded and then transmitted back to the clinic. There's a number of different things that can be used off of the device. Some of them actually can track activity. How far are people walking in a day? A lot of people know these health apps that are on the screen that you can use. There's another question asking about pulmonary tests. And again, that's one area that has already been done that is showing reproducibility, meaning it's reliable. You can get data that is very similar to what you would get in the clinic. Yeah, so EMGs, somebody asked about that. No, we can't do EMGs remotely. We can't do nerve conduction studies remotely. Unfortunately, those are at the time that we're really diagnosing patients. It's not going to be at the time that we're doing our, research trials. Another person is saying that they are glad that people can participate in telemedicine. The way we have organized it now, and I think the way that most of the clinics are organizing it, is instead we'll just take one of the rooms from the clinic that we would normally have a patient physically in, and we'll have a computer there with a camera, and then we will basically all rotate through that room, just as we would if the patient were there physically. Another question here says, if COVID isn't a factor, could a clinic team member go to the home to set up access for the visit? And we haven't done that yet. I think it certainly could possibly be done. We haven't done that yet. We've done telephone visits with patients who don't have, a video device. We've used those instead. But okay. Well, listen, I appreciate everyone's attention. It's my pleasure to talk to you all, and I'm going to turn it over to the other folks. Thank you very much.